Hi, my name is Russell Pachynski. I'm an assistant professor here at Washington University in St. Louis in the Pathology, and presenting ASCO highlights from genitourinary non-prostate issues. So in urothelial carcinoma or bladder cancer, talked about a Hoosier Cancer Research Network looking at neoadjuvant chemotherapy with the addition of Nivolumab, really showing that patients that achieve a clinical CR after that can potentially avoid cystectomy. Some promising results from that. We talked about the Javelin 100 bladder cancer trial, which led to the recent approval of Nivolumab in advanced bladder cancer after chemotherapy. 4520 was looking at potential biomarkers and subgroup analyses. Really didn't show any any potential subgroups. There was robust response across a number of different subgroups and TCGA histological subtypes. Within kidney cancer, we talked about the Keynote 426 trial, which was axitinib and pembrolizumab compared to sunitinib in the first-line setting. This was the long-term and final analysis of that trial, and continue to show impressive benefit and overall survival improvements of axitinib and pembrolizumab over sunitinib. There was some data presented around the quality of life for patients in the CLEAR trial, which looked at Lenvatinib and pembrolizumab compared to sunitinib in first-line metastatic RCC. Here, excuse me, here they showed improved life with the combination of Lenvatinib and pembrolizumab compared to sunitinib. The next abstract 4509 looked at Nivolumab and cabozantinib in non-clear cell RCC. This was a single institution study, looked at a number of different non-clear cell subtypes, and showed a relatively impressive overall response rate in those patients. So certainly setting up a larger either phase 2 or randomized phase 3. And finally, one of the plenary sessions, Keynote 564, which was a large phase 3 double-blind randomized controlled trial of pembrolizumab in post-nephrectomy RCC, showed a significant improvement in its primary endpoint, disease-free survival. Overall survival data was too immature, but started to show separation of the curves with no new safety signals. And so this is very exciting. I presume the FDA is reviewing this currently. And a number of other similar trials are in the works. So maybe in the near future, we'll have a good treatment option for these patients. That rounds out the highlights. Thank you.